Well, I'll go ahead and get us started here because we do have a full agenda, lots to get to today. We'll be talking to a panel of experts on adult day services today. And adult day service programming really is an engaging and community-based care that supports people living with dementia and provides relief to their dementia caregivers. And a couple weeks ago, we did host a webinar specific to respite care. Some of you may have joined us then, and if not, we'll share a link to that. And in this webinar, we learned a little bit about respite care services more broadly and types of programs it includes. Adult day services are just one of those programs, and today we'll take a deeper look at what they are and some opportunities and challenges that they encounter. And we'll hear a little bit about the experiences of a few ADS programs that have taken creative and innovative approaches to support people living with dementia and their care partners. So as I mentioned, again, today you'll hear directly from some ADS professionals about their experiences and examples of how these programs work on the ground. And most importantly, we'll also explore how public health departments can support and expand ADS in their communities, hopefully leaving you with some practical strategies that you can apply in your own jurisdictions to promote and strengthen these programs. So before we get started here today, let me introduce myself. I'm Ashley, one of the coordinators of the BOLD Public Health Center of Excellence on Dementia Caregiving. Happy to have you all joining us here today. And we'll start by sharing our land acknowledgement and just acknowledging that the University of Minnesota is located on traditional, ancestral, and contemporary lands of Indigenous people. We acknowledge with gratitude the land itself and the people. We take to heart and commit through action to learn and honor the traditional Dakota values, courage, wisdom, respect, and generosity. So just a couple reminders let me back up. We'll actually start with an overview briefly of our center, the Bold Public Health Center of Excellence on Dementia Caregiving, PICO for short. Many of you are probably already aware and familiar with our center, but for those of you who might be attending for the first time today, we are designed to support the work of state, local, and tribal public health agencies nationwide as they develop their infrastructure and programming to support dementia caregivers. And we do this through improving access to evidence-based programming, facilitating connections, and providing technical assistance. So we welcome you to visit our webpage to learn more. You can also scan the QR code here, and it'll take you there. A few reminders for today's session. Please use the Q&A feature to submit your questions to our speakers. Some of them will be answered directly there, but we'll also have time to have an open discussion and bring those questions directly to our speakers. We also encourage you to use the chat feature to share any comments, resources, links, and ideas. But again, please do put those questions into the Q&A. A reminder that the recording will be shared afterwards, along with the slides and any other resources that come up with this webinar. And lastly, please complete the survey at the end of this event. It'll show up in a Zoom box right when you leave the webinar. We really do appreciate your feedback and we use it to shape our events. So again, that link will pop up automatically, or you can scan the QR code here. Okay, so before we start, we do like to just see who's all joining us in this virtual space today. So I'm going to launch a poll here for you all, and if you could just take a moment to let us know the capacity that you're joining today. So it should be showing up on your screen here. We'll give you just a moment to respond. Okay, so it looks like we got about a third of our attendees coming from community organizations and service providers, about 20% from different BOLD public health agencies, and then another good chunk joining us from non-BOLD public health agencies. So thank you all for joining us today. And with that, I'll go ahead and introduce or turn it over to our speakers. So I do want to thank each and every one of our speakers for joining us here today. We have speakers joining us with various backgrounds and experiences in adult day services from really across the country. So I'll turn it over to Dr. Lauren Parker, who will be today's moderator, a colleague and member of the Bold Public Health Center of Excellence on Dementia Caregiving. So, Dr. Parker, over to you.
Perfect. Thank you, Ashley. And everyone, happy Tuesday. Thank you for being with us this morning. We're so delighted that you came to hear about the wonderful world of adult day programs. I am biased because I am community-based scientist and all of my work primarily focuses on adult day. So I'm super excited to introduce our wonderful panel today. We have William Zagorski. He'll share a little bit more next and he'll give a great overview and informative presentation about adult day services. Following Bill, we'll have a great panel conversation with Rochelle Roberts, Tia Saucedo, Doris, Carby Diaz, and Anastasia Pogini. We will have a great time to ask questions. We already have pre-assigned questions that we're going to ask throughout for our panel conversation. But as you all are in the audience, please feel free to use the Q&A feature at the end to just have more questions as you're thinking about how your public health program at the state or any level can really engage and partner with adult day programs. So at this point, I'm going to turn the stage or the mic over to Bill. Thank you.
Thanks, Lauren, and thanks everybody for being here. I'm going to try my best to move quickly and give the global overview. Adult day services is a highly fragmented and extremely varied industry, but I wanted to give kind of that quick primer and a few slides. Again, I promise to be as quick as possible. I can be rather long-winded when I start talking about what I love, but we'll just go into some of the basics and the global overview and really get into the meat and potatoes, and the panelists here today are fantastic. So thanks, Lauren. And I do own and operate an adult day program here in Middle Tennessee. I've been part of this. My parents started our organization in 1991, so I was young at the time. My previous background was actually in academic science and medicine before coming back about 15 years ago and falling in love with the industry. And I've had the pleasure of being the research committee chair and then the board chair for the National Adult Day Services Association for the better part of 6 years. It's a fantastic organization. I'm very happy to have Tia here on NASDA's behalf too. So, next slide, please. So really quick overview, what are adult day services? And for those that have heard me present or Tina Sadarangani or others before, it's much more than dances and dominoes. It's not just a senior center. It includes skilled care, clinical oversight, and is really a platform for chronic disease management. There are 50 different states, 3 territories, and about 450 different definitions of what adult day services are. The National Association really tried hard and labored over some very specific words for the better part of 5 or 6 years to come up with a more comprehensive definition. And in general, adult day services is a system of professionally delivered, integrated, home and community-based, therapeutic, social, and health-related services provided to individuals to sustain living within the community. That gets the global overview and includes the entire spectrum of services across the United States. Primarily community-based programs. They are embedded within the community, designed for individuals with cognitive, physical, intellectual, developmental disabilities, every impairment that you could think of, and is inclusive, and it is age and diagnosis agnostic. Some programs are very specific. Others include everybody, but it is really for anyone over the age of 18 who cannot or is not able to stay at home safely by themselves all day, but does not want to reside in an institutional setting. It allows people to age in place. We provide health, social, therapeutic services during the day, and I could go into this in great detail over the next 3 or 4 hours to give the daily programming, and some of it are therapeutic delivery services using art therapy and music therapy. There's art activities and music activities, but engaging individuals where they are. But overall, it's a comprehensive health and social network. Supportive environment includes meals, supervision, structured activities, health monitoring. Over 50%, or about 50% of the industry is in the medical model or medical adjacent space and really provides nearly wound care, but the same level of services provided in a nursing home. Next slide, please. Why does it matter? For years, this industry, we have talked in stories and anecdotes, which are absolutely true. However, there is a growing body of evidence in the scientific community to really show this evidence-based delivery of services for community care for people living with dementia, cognitive, physical, intellectual, developmental disabilities. Like I said, it is an industry that's between 4,000 and 7,000 locations strong across the United States, providing that cognitive stimulation, socialization, and structured routine. It really does come from the pharmacological and non-pharmacological therapies involved in caring for individuals with cognitive and physical illnesses. There is a growing body of evidence with using evidence-based collection or evidence-based tools to collect information on quality of life, function of the kind, healthcare utilization, functional assessments, and then coming soon, there's a new publication coming very soon where we'll be adding into a national data set to include additional quality of life measures too. Overall, it offers caregivers respite and a peace of mind. Caregiving is a 24-hour a day, 7-day a week, thankless and breakless job. Adult day services exist to allow that respite to take place. And these interdisciplinary teams are trained in dementia care and culturally specific practices. I know Doris is here today. She and I have known each other for a long time, but you see this growing body of culturally and linguistic appropriate services that are very responsive to the needs of the individuals in that community. And I always want to mention that it's truly a continuum of care. Adult day services represents a spectrum of services that really starts in very short, part-time drop-in, faith-based respite that might be an hour or two once a week, and moves into social model programming and moves into medical model programming, to specific individual programming, culturally class services. But it really includes the entire spectrum of service providers across the United States. And so at the end of the day, there's something for everybody. Next slide, please, Ashley. So again, one of the biggest benefits that's easy to show from data with data is that social connection and the balance with health. Adult day services offers peer engagement, group activities, and purpose-driven routines. It's generally not the staff that are encouraging participation. It's peer support. Individuals are there with other individuals in a similar situation, in a similar background. And that really fights loneliness and social isolation, which is truly a public health threat. And I really wanted to hammer this home today. The social isolation is increasing, especially post-pandemic, leading to geriatric depression, leading to other negative health outcomes, increased risk of dementia of up to 40%, much higher rates of depression, cardiovascular disease, and morbidity and mortality, and an increased rates of hospitalization and functional decline. Adult day services allows to avoid and prevent that functional decline and prevent high hospital care utilization. So this is where public health could really, partner with the adult day industry. But adult day services monitor health, promote wellness, and restore connection, and directly intersect with that public health system. Next slide. I really want to acknowledge that some of those challenges and barriers that I've alluded to. This is a fragmented industry. It is regulated differently in every single state, often every single city, and sometimes even every single municipality. There are social models of care and medical models of care. Sometimes there's licensures, sometimes there's not. Sometimes there's certification, sometimes there's not. But it's highly variable, and generally it is delivered by smaller organizations. Over those 4,000 to 6,000 locations, there's probably 3,000 to 4,000 different owner operators. The largest provider of adult day services represents less than 2% of the industry in the United States. So it is not an easily scalable model. So that gets into kind of the last point of what are adult day services. The general public generally does not know. Access to them can be a problem because of that fragmented network. Transportation, especially in rural areas, is a barrier. There is more and more work going into that. I don't have the solution yet, not that I can scale to the entire United States, but providers have been very involved in some of those solutions. Funding is definitely always an issue too. Again, this has been I have a little bit more information about the payment models in the next slide too, but funding the availability of services. Again, the public generally does not know what adult day is. They don't know who uses it and who pays for it. But historically, adult day is a Medicaid service. More than 50% of the revenue currently is paid for by Medicaid. That had been closer to 90% 10 years ago. And it's not that Medicaid is paid less, it's that other payers are actually increasing and paying more. Of course, it's hard not to acknowledge, the recent activity in Washington and the challenges with state budgets coming out of a result of HR1. That's still yet to be determined. Some states will have a greater impact on home community-based services, and some will not. That's still, again, it's very much up in the air, but it's causing a lot of fear in the entire home and community-based service industry and every Medicaid delivery. Again, highly variable utilization is and implementation is going to be a big challenge over the next few years in Medicaid space. Long-term care insurance generally pays for adult day services. The VA is now the second leading or the second largest payer of adult day services across the United States, and it's not a medical benefit for veterans; it's a social work benefit. So it's available for all veterans, regardless of their disability and their service connection or their income. And it generally pays for up to 5 days a week of adult day services, often including transportation and the medical supports with it. There is more and more coming from the veteran-directed care, the person-centered care program with the VA as well. There's more and more states that are utilizing family caregiver support programs through the Older Americans Act, often Title 3E, 3B, and some state grants that are associated with it. Usually those state units on aging and the area agency on aging and disability. Private pay still represents more than 20% of the industry nationwide. Average daily cost is around $100 per day, and that's across the United States. And we'll have a link at the bottom that Genworth provides a non-biased cost of care analysis every single year. And there's more information on the NASDA website too. So you can see what the adult day service annual average cost is in both in your state, and it actually drills down into the local zip code as well too. I'm very excited about the new guide model from Centers for Medicare and Medicaid Innovation, guiding an improved dementia experience. It is a novel caregiver support program that pays for some respite services, up to $2,500 a year of respite services for caregivers of individuals that have traditional Medicare and a dementia diagnosis. There's about 80 G codes that are included in that. And that's now just started its second year of an 8-year pilot. The data and the outcomes that are going to come out of that are pretty fantastic. So, I really wanted to go through a little bit more of this background. Happy to entertain questions later or offline. But adult day services is evidence-based. It is dementia-informed or dementia-capable. It does utilize the best practices that are associated with all the evidence that's available and the growing body of evidence coming as well too. So without any further ado, I'll take a breath. I'll stop talking. I appreciate the opportunity today, and I look forward to the entire panel discussion.
Well, thank you so much. Now we're going to ask our parents and Bill, please feel free to jump into the questions as well. So we're just going to open the floor to a Q&A. So adult day programs are often seen primarily as social care, but they play an important role in the public health continuum. How do you all see adult day services advancing population health goals, particularly for older adults and caregivers?
I'll start. Respite, respite. I think we all need breaks, from mothers to young children to mothers with older seniors. We all need a break. So adult day services does provide that respite, much like what we give to our children, that time that they go to school and they interact with other children and they have other people that look at them, that it's not their family, that's just separate friends and peers, just what we do for our children. The same thing we need to do for our seniors. So social daycare kind of provides that venue for us to be able to provide that space, that safe space, and at the same time, the respite for the caregiver, much like what we do for our children.
Yeah, and I would just add, Doris, I mean, I always tell people when you're talking about adult day, well, caregivers in general, but especially an adult day, you're taking care of at least two people, if not more, because no relationship, I don't care how good it is, can withstand 24 hours with each other. And so it's like if I take care of the caregiver, I'm taking care of the person. If I take care of the person, I'm taking care of their care partner. I prefer that word. I just said caregiver, but really adult day is a public health solution in my mind, right? Like it's not just social services. This is creating low cost, high quality care, keeping people in their homes, which is, I think, if we were to ask our audience how many people want to age in place in their home, 90% of them are raising their hands right now. And so adult day is that solution.
I love that public health is the solution. So we know we've talked a lot about the great benefits of adult day, but what needs? I mean, the great thing about this panel is that we've covered pretty much all of the regions in the United States, but what needs do adult day programs have that state or local public health programs can help meet?
I don't want to talk the whole time, but I will. I'm kind of like Bill. You're going to have to cut me off, I think. Um, I think the need is awareness, and I don't want to oversimplify it, but the majority of people don't know that this is an option. And so we as a community have to do a better job of sharing that this is a choice, this is an option. And I do think it starts at the public health level, right? Like when I think about public health departments, that's where I get my education on what is safe, frankly. I mean, kind of on a broad, big picture. And so for me, I think the public health departments not only have an opportunity, but I would even go as far to say have a responsibility to share that this is a choice and this is an option in Colorado. So I'm based in Colorado for anyone who doesn't know. And I know that there are groups like this across, other states, but we have a group called the ADDRDAC. So it's the Alzheimer's and related dementia ed, I don't remember all the detail. It's some community council. But there is a public health, there's a PR campaign that's being done at a public health level, right? To educate people on, the dementia signs and providers, doctors, physicians, all the way down to, individual residents, right? And it's educating folks on where do you go to get dementia resources. And, when I joined that group 5 years ago, I was, sort of like, well, how are we going to actually do this? And it really comes from everybody talking about it and having that public health component. So that's what I would say. I'm going to jump out now and let someone else join in, but I think there's so much opportunity there.
I would add to that to Tia, just to saying that I wish our public health departments saw us as a partner, not as a nice to have. Wouldn't it be great if they had, as a partner, and using our availability of this coordination and care, this collaboration, we address the social determinants of health. And as a community, we understand the importance of those social determinants, and we've named it. We've given it an acronym already, health-related social needs. We've given them acronyms. Now we need to recognize, yes, they're important, and how can we now handle and address these important issues? And senior centers are it.
I love that. So it's so interesting because I thought you were all going to say funding. So see, this is me as a scientist.
I probably should have said funding,
Yeah,
so please add that.
yes, yes, yes. So, Tia, I want to ask you a question because I know that you are in Tennessee. Can you share some examples of successful partnerships that have maintained and strengthened because of adult day service programs?
I think that's Rochelle. She's our expert there.
Oh, I'm sorry. Did I say Tia? I'm looking at Rochelle and I said it's charged to my head and not my heart. So, Rochelle, I
Okay.
apologize. Thank you.
Yeah, thank you. So, Rochelle Roberts, I work at the Tennessee Department of Health and I serve as our uh, state dementia director. And so, at the Tennessee Department of Health, we've engaged with adult day services through multiple strategic channels. And that includes the Tennessee ADRD state plan, which is created by the ADRD Advisory Council, which is legislatively mandated. And it specifically identifies respite as a public health priority and highlights adult day services as a key strategy to support both caregivers and people living with dementia. So that plan also calls for expanding our respite options statewide and embedding ADS into dementia capable systems. We've also ensured that ADS has a seat at the table in the Tennessee Dementia Action Collaborative, which is our TDAC, the same version as Colorado, I would assume, where we have our cross-sector partners, where we align on policy and practice, and you can actually participate in a caregiver-focused work group. And then importantly, our CDC Bold funding is really a catalytic to this work. So BOLD has given us that capacity to elevate ADS within the dementia and public health conversations, integrating them into Healthy Brain Initiative or HBI roadmap priorities, and frame caregiver well-being as a population health outcome. We're also building out a public caregiver support page on our website that highlights adult day services as a respite resource, positioning them again not as that social care, but as an essential public health and age-friendly infrastructure component. And like Bill had said about Guide, we're linking our ADS to our Guide model work. So Guide is again guiding an improved dementia experience, the new CMS care delivery and payment model. We've been able to pull together Louisiana and Tennessee recipients to create this kind of technical assistance learning collaborative. And pulling these guide implementers in and strengthening that integration and uptake within our ADS resources within Tennessee and Louisiana, but also just to show that there's a huge need. And so we want Tennessee to be that #1 user of Guide and expand those resources and the amount of money that's allocated to each caregiver. And what's working well is really reframing ADS within our age-friendly and prevention-focused continuum, like Bill had said. And I swear I did not see his PowerPoint before this presentation. So, but just creating that visibility across health and aging and dementia systems through the relationship building and partnership. I think that's the key part of the conversation. We know every single sector is stretched and we can't do it alone. So there are pieces and parts that we can all pick up and do this together to really elevate. Like Bill had said, challenges that remain are sustainability, integration, awareness. So our funding streams are limited. Workforce capacity is under pressure. And too often, I think day services operate on the margins of clinical and public health systems when they should be in the mainstream. So we have a lot of work to do, but public health, this is what we do best. So we're here for it.
There were so many. If I really like that nugget, how we operate in the margins, but really should be in the mainstream. And I appreciate that comment. That's a really meaty comment, so that's great. I see that there's some questions here about Guide. We're going to go back and forth between the Q&A box and not. Oh, I think Bill might have answered it. But the question was regarding Guide and talking a little bit more about how Guide could be used to cover respite. So, Bill or Rochelle, if either one of you wanted to comment on that, that would be helpful.
Rochelle, you want it or you want me?
Go ahead. We'll just bounce off of each other.
Sure. Yeah, I mean it is a new benefit. I just put a link to CMS's website. There are so it rolled out just over a year ago. Went live for existing programs July of last year. New programs July of this year. There was an RFP that went out, but I believe there's 432 providers and guide participants across the United States. And those participants, some of them are health systems, some of them are public health agencies, some of them are hospitals, some of them are community-based organizations. But CMS encouraged whoever the participant is to work with local community partners wherever they're licensed. And a number of providers are licensed either nationwide or in 10, 15, 20 states. Some of them are very local. But what these individual programs do, there's a number of different aspects to the care delivery model, and it includes some clinical services, and it includes some dementia care navigation services, and there's some fingers in each of those. And then also included with that for individuals that need a medium and a high tier complexity and live with a caregiver, it comes with $2,500 a year of respite services. And that respite can be delivered in a home care model, in an adult day model, in a licensed assisted living model. It is it's highly varied. CMS does set those rates, so it is a per diem rate. It's a 4-hour delivery of in-home service, up to an 8-hour delivery of adult day, and a single per diem rate that's revolving for the institutional or the overnight care and assisted livings. There's some modifiers depending on the municipality, but by and large, the adult day reimbursement is about $97, $98 a day now. And so that's average, the social model of care cost. It is 100% pass through, whatever the participant is that engages with a home care, assisted living, or adult day. So it is direct fee for service. It's just billed individually. But every individual that lives with a caregiver that meets a moderate to high complexity is available for that $2,500 a year. And so any program, adult day, home care, assisted, should be partnering with the guide participants in their state or the national guide participants that are in multiple states.
If there's anything else to add to that, Bill, that was great.
That's so promising and very exciting. I mean, respite is such a huge need for all. I'm going to refer back to a comment that Bill you made in your presentation. I mean, you were kind of alluding, it's kind of alluding to if you've seen one adult day program, you've seen one. They're not all the same. And so I'm going to direct this next question to Anastasia. I know that there are so many innovative programs and models of adult day, and your program, One Generation, has a unique approach with intergenerational approaches. Can you speak a little bit more about that and how you've been able to partner with public health programs in your state?
Sure, sure. Hi, my name is Anastasia Plugina. I'm a marriage and family therapist, and I'm also the program director of One Generation's Intergenerational Adult Daycare. One Generation is a nonprofit agency, duly licensed, meaning we provide both the social model and the health model. And we partner with Veterans Administration. We work with Medicaid. We work with the regional center. We're implementing the guide model. And we also offer the private pay piece as well for our clients. And we primarily serve clients. Our services are directed to clients that are living with memory impairment, Alzheimer's, dementia. What makes us unique and really stand out in our community is that we will offer intergenerational programming. We are very lucky to be located on the same campus as One Generation Childcare that serves children from 6 weeks to 6 years old. And we provide opportunities for children and older adults to come together on a daily basis. Actually, up to 7 opportunities per day for those 2 generations to come together and engage in activities. And we have an intergenerational department where it's a small but mighty department of 2 people that build the curriculum. They supervise the actual intergenerational activities, and we have before our clients in adult daycare and children in childcare, before they enroll into our service, we of course provide disclosures to the families and the parents, and we receive the agreement to participate in the intergenerational program. Older kids, such as toddlers and preschoolers, they come to our site, our adult daycare, in the mornings, and they participate in things like arts and crafts and music programming and seated sports and gardening. And later in the day, we walk our participants, our older adults, to the childcare. We call that a nature walk because we have a beautiful campus with trees and really nice greenery. And we walk them to childcare to engage with our babies, the little ones. And they're able to hold the babies, engage with the babies, help feed the babies, spend time with the babies. And we found that that really helps both generations enormously. With our older adults, those activities address social isolation, loneliness. A lot of our older adults don't really have grandkids or don't have grandkids here in Los Angeles, where we're located. And the same goes for the children. They might not have grandparents locally. So that really provides them this opportunity for those 2 generations to really benefit from the interactions. And it helps tremendously with mental and physical health of older adults. And it helps with reducing ageism. Our little ones, and we call them our little neighbors, they're exposed to older adults using canes and walkers and wheelchairs, and They don't have that barrier. They're not scared when they see somebody using those assistive devices in real life. And just when they come in, we usually sing a song to greet them. And not every participant, older adult, participates with the children. It's very person-centered. So every day we offer our participants, would you like to participate with the children, or would you like to continue doing balloon volleyball, which would be our main activity? And those who choose to participate with the children, we take them to a separate room to do that. But everybody, sort of all participants, see children walk by and sing a special song, Hello Neighbors. And even that already brings positive impact and an increased mood to our older adults. And our daily attendance, we serve about 150 children in childcare. And we have about 40 older adults coming in here daily. I think that's an overview of our program.
Yes,
I'll take any questions.
that sounds so exciting and such a wonderful model. Thinking about things we can implement all over. Everyone needs care, child care, and care for older adults. So having it all in one place would be such a great resource, especially for people who are kind of in that sandwich generation that we hear about from time to time. Um, so thank you so much for that. So, Anastasia, just specifically, how have you all partnered with public health? So the state of California or your local public health for your county, have you all had any programs together, or you've implemented at One Generation?
Well, here in California, we are licensed through community care licensing for our adult daycare. We're also are working with California Department of Aging for our community-based adult service, or CBAS, which is the health model. And also the childcare has a different type of licensing. So Department of Public Health primarily plays a role of giving us guidance in terms of infection prevention. I know we received a lot of guidance and PPE during COVID pandemic. Um, if if we have, let's say, a COVID outbreak, Department of Health is here to sort of help us navigate that. But licensing here in California, it's very complex, and there's different entities,
Okay.
primarily community care licensing.
Okay, thank you for that. So a little bit thinking more about that sandwich generation, Tia, I'm just curious in your thoughts. How can programs support families balancing children and older relatives?
Yeah, I think that, you know, what we have to recognize is that sometimes when you're in the adult day space, you're thinking about the person, the participant who's attending. But when in reality, if you're not looking at the caregiver, the person who's managing that person's day to day, you're missing the boat. And we know the sandwich generation is feeling it very, very deeply right now, right? You've got kids in school and you've got your parent living at home. And so adult day is that way for that person. I'm just going to use an example, right? To be able to go to work. So I can safely drop my mom off. I know she's okay. I don't have to worry about her. I can also, get my kids off to school, and then I can go do the thing that I need to do. Most of the time go to work, but sometimes I hope they're out there taking care of themselves. And the reality is as an employer, right? Like I think about it on a couple different levels. Like if you think about public health departments, they're also large employers. They have a lot of workforce that, are there. How many, I think the statistic I used to use was 40%, but I think that that's even low now. 40% of people are caregivers. And so of that, if you're at work and you're worried about your mom at home cooking and your kid at school, like you're not productive, right? You might physically be sitting in that seat, but are you actually doing any work? And so I think that adult day can really help ease that burden. I have heard time and time again, and for what it's worth, I was a provider of adult day for over 25 years. And I have heard time and time again people come in and say, "You saved me. I could not have done this without you. Mom would not have been able to stay living at home." And so I think, adult day strengthens the community because it reduces hospitalizations and skilled nursing admissions. It supports healthier, more resilient caregivers. So I was actually talking to a person, and it was about her child, but it really connected in terms of your older adult. Her daughter had just started school, and she was like, when she comes home, now I'm actually excited to see her. I'm actually happy to play with her. The same is true of your caregiver. If you have that break and that person gets to come do something that is just theirs at the center, right? I get to fully be me, and then I come back to my caregiver who was also fully them for 8 hours, 6 hours, whatever that number is. When they come back together, they're actually happy to see one another. They're actually happy to sit down and have a meal together. And so it really extends, I think, like the lifespan of a caregiver, not only like physically their literal lifespan, but their ability to continue to be a caregiver, right? If they have that support and they're not being pulled in 8 directions, they can do this for longer, which again, we have the outcomes. We know it's that, we know the evidence is there that this is providing um, quality care at a lower cost while supporting that person. And again, it's two people. It's the person in the program and the care partner.
I really like that, Tia. I was just thinking, and this is for everyone. How do adult day programs align with or support caregiver well-being? So we hear a lot about how the programs are helping the actual person living with dementia or some type of chronic condition. But how do programs really align and think about developing supports for the caregivers?
I will let others add what they do, but I will say that that was critical when I was an operator. We had support groups, we had care partner dinners, so places we weren't open in the evening, but we would have dinners every couple of months, and we would do it two ways. One, the caregiver could be there and get education while their person was in another room enjoying an evening out, or a couple times a year we bring everybody together because going out to dinner isn't enjoyable for most of our folks, right? There's odd things that happen, there's embarrassment that comes with that. So when you're in a group with people who are in it with you, right? There's just that commonality and there's that community that is built. And I think like at the core, I'll go back to public health being about the community and having that camaraderie to know that you're not in this alone and that this is okay, I think is really critical. And so I think if you're not providing caregiver support, you're missing the boat. I'll just say that.
I just wanted to add that we provide, like Tia said, we provide caregiver support groups. We collaborate with our local Alzheimer's Association to really do in-person and virtual groups. We collaborate with local universities to do educational workshops or caregiver boot camps that we call them, where a caregiver is sitting and receiving education, caregiver support while we provide respite for the older adults. Weekend respite is something that we've also provided. We find grant opportunities for that, and we provide that free for our families. So there's a lot of opportunities, and of course, education, education, education. We collaborate with a lot of partners to deliver that caregiver education to the caregivers and the families in our adult daycare.
Yeah.
We have a whole different side of that because we are a Spanish language, culturally specific senior center. So we're addressing the cultural and linguistic barriers that our seniors face, but their caregivers also face the exact same barriers. So we come in as a community support provider to not only create a safe, trusted space for the senior to come spend time, we also create the same space for our caregivers. For example, right today we have our Vacúnase entre amigos. We can see that. So we have our vaccine clinic going on downstairs right now. So when the caregivers come by, when they drop off, pick up, hey, before you leave, grab a quick flu shot, grab a quick, a shingles vaccine. We have them right here. Yesterday we had, we opened our center to the physicals of, we're in New York State. So we have a company called PPD, PPL, which does the Consumer Directed Personal Assistance Program, which is nationwide, but New York calls it CDPAP. And they have these physicals that are due. So it's very hard for the caregiver to coordinate their life. So what we do is we bring them here to say, hey, when you drop off mom, you can do your physical right now. you can get this done, just to kind of overcome the barriers that they are facing too. Language and culture, many caregivers, I think in New York State, we have over 47% of caregivers are immigrants. So they have a whole new healthcare system that they have to navigate, not only for their senior, but also for themselves. So we can provide that one-stop shop to say, okay, you're dropping mom off, pick up a quick flu shot or pick up a form or pick up any information they need to help them. Today's our Mexican Independence Day. So, we have our celebrations going on, letting them know they feel they are seen, they are heard, and they are welcomed. And that, I think, goes a long way for our caregivers.
That's so amazing. It's like I kind of wish I could have a little small trip and go to each of the sites because they all sound so fantastic. So there are some comments in the chat, and so I'm just going to read. So there are several questions about falls and mitigating fall risks and thinking about staffing ratios. So, do you all have anyone in the panel? Do you have any experiences with mitigating falls and thinking about how do you mitigate risk with falls, considering that a lot of sites have shortage of staff?
Furniture. I just have to say, when people design senior centers, please design places to hold on. Chairs that are stable, tables that are stable, a chair rail that has a little lip on it so you can hold on. I think when you design a senior center, please make sure that you have plenty of places to hold on to, because they do fall. And I think that's a big thing. You have a lot of seniors in one space. You have a lot of people walking by each other. It's a risk, but it's a risk that you can mediate with preventative
I,
design.
I would also add, of course, like one of the things that I think, yes, falls do happen, and I think, there's lots that you can do to prevent them. One of the beauties of adult day is most adult day centers offer multiple exercise, classes during the day. We work on balance, we work on strength. Many adult day centers have physical therapists right on site. And so you can identify somebody who, maybe is a higher fall risk, and then, get them some additional, whether it be adaptive equipment, whether that be education, whatever that, is, adult day centers. And I think that this is true for most health, I'm going to just say health related things, right? Even a social day center, most of the time has a nurse on site. A social day center has CNAs, certified nursing assistants on site. And so we really are the eyes and ears. We see things way before families, because with anything, like if you're too close to it, you don't see it. So I cannot tell you how many times one of my staff members said, hey, Tia's acting a little off today. What's going on? And we identified quickly something was happening. Because we know these people so well, because we are person-centered at our core, we can identify those things and get to them ahead. I'm not saying we can stop every fall that's going to happen. However, what we can do is build strength, build balance, and educate our caregivers on what to look for. Again, probably hundreds of UTIs in my lifetime that we acknowledged and went, something's not right, and that I think could have prevented a fall. The other piece is a lot of adult day centers also have other components to their services. So they have care managers, care navigators, social workers, whatever you want to, I mean, they all have different names, but there's a lot of that education that happens up front during enrollment. You ask questions like, hey, do you have a lot of rugs in your home? What are your barriers at home? Does this person navigate safely by themselves? So asking those questions and getting care partners just to be aware. Yeah, my mom has her house decorated the way she's had it for 50 years. We may need to change a few things. And so to summarize, adult day is often the first eyes and ears when you're looking at somebody's care, and they really can get there and provide interventions that not only work, but they feel good, right? You're not being prescribed something, you're being included in something. And that alone is the beauty of adult day.
And I think too, this is where, again, you leverage your public health infrastructure in your state. And so specifically WT extension, and they have an extension agent designated for every single county, and they are trained in movement oriented classes. So matter of balance or chair yoga.
Yeah.
I did chair yoga for the first time in a recent meeting, and it was a lot of fun for me. And so, and then just the drumming on the stability balls. So there's modifiable activities that could take place to help promote that fall prevention, and again offered here in Tennessee free. It's just a scheduling process with UT Extension. So I think looking at that, and then any grant opportunities that you have with your health department, um, a little bit of money to purchase the items that you need to facilitate these programs, it can be sustained within the adult day centers. So look for those opportunities and use them. They're there. So you just reach out, make those connections.
Thanks, Michelle. And I was going to chip in too. Anecdotally, the incidence of injury-inducing falls for participants in adult day services is significantly lower than a matched for our population, as well as lower while home and outside of the adult day centers. Again, anecdotally, there is a lot more data collection in place, and as a release as part of its uniform outcome measures a few years ago, a best practice for all adult day centers to be utilized in the Hendrick 2 fall risk assessment, which provides a lot more background on an individual's fall risk at enrollments and monitoring that over time. And again, I don't have the statistical significance to show yet, but we have about 100 centers are participating across the United States with over 1,000 participants, showing the fall risk has not significantly declined in a number of years, even though it's a chronic disease that continues to progress. So it is that information that adult day centers prevent the degradation of functional outcomes and reduces injury-inducing falls. Again, the information is available. It hasn't been collected in a wide scale or a wide area on a big net. The other aspect I was going to mention too, we talked about the question had a little bit to do with staffing ratios. Generally, staffing ratios, they do vary significantly across the United States. Kind of the mean in adult day services is about 1 to 6. And some states are 1 to 8, 1 to 9. Some states are 1 to 4, 1 to 5. A lot of times, the higher medical model of services, the higher medical fragility, the lower the ratio. So it's a 1 to 4 or 1 to 5. Most programs operate in that 1 to 6, 1 to 7 ratios. Social and respite models might operate at a slightly higher ratio too. But even in that, with that ratio, a 1 to 6, a 1 to 7 staff to participant ratio allows for the delivery of services in a safe and secure manner, hence the reduction of injury-inducing falls in a facility. And again, not to be a little bit crass about it, but adult day services are fee-for-service programs. If an individual has a fall, they are generally going to be hospitalized. They will probably go to rehab and be out for a number of times. Adult day centers protect their participants because that's the only way they stay open and fun. So they will do everything in their power to ensure those members are safe, are secure, are happy. So I'll figure out a way to assess that one later.
That's really helpful. So I'm going to go to some questions in the chat. Um, a question from Kelly is, what innovative strategies have you all seen for rural communities that are facing staffing challenges? Or just if you want to talk about barriers or anything else as it relates to rural communities as well.
I'll just say here I'm in Haverstraw, New York. We're semi-rural, but transportation is so bad that I can say we're rural. I think the issue biggest is trust. Trust that trust, especially with diverse families, trust is the biggest barrier. And how do you get me there? How are you going to get me there? How are you going to get me home? And I think that conversation, having it and having a plan. Every adult day center, we just got to figure out, how is this going to happen? I mean, logistically, how is it happening? Because the seniors need it, and isolation kills us. And we all know this is real. So how do we do this? It's really just a question of collaboration and trust. Trust that you'll get my dad and my mom where they need to be, and trust I can bring them back the same way. Working with, we work with the Rockland County trips. We work with uh, uh, public transportation. We work with our private buses. We work with cabs. We work with Uber. You know, we'll figure out a way to get you back and forth. And that's back to the trust. Saying, just trust me. I'll get you here and I'll get you home. Like Bill said, it's our business.
What you said, Doris, was so true of community, right? And each community, whether they be a rural community or a culturally specific community, there are those nuances within them that you have to understand first before you go to try to solve that problem, right? And so, based in Colorado, we have the rural plains and we also have the rural mountains, right? So we served a lot of the mountain community, which are very slow to trust, and certainly like, hey, I'm not leaving my home. I've been here for this amount of time. And I think that that's true in other communities, don't get me wrong. But realistically, what works is finding that person, that those people within the community, because that's who they trust, right? And so so we provided home care forever, and it was like our home care providers were neighbors. And the same could be, I had a day center in a small, mountain town as well. And that also was the place to go get lunch. It wasn't just the day center, it was the community gathering place. And so I think that you have to leverage that. I think transportation, to Doris's point, is also probably the one of the biggest barriers. Um, you can't just hop over real quick to your day center. But I will say, I mean, again, Colorado, I was in a Denver area, but I would have people drive 40 plus miles to come to my day center if it was a good day center, right? And so part of that is people will make the trip if it's worth it to them. And if you're also getting X, Y, and Z while you're there, now it's worth that 40-mile drive or that 40-mile Uber, whatever it worked out to be. Because I also know that, hey, my person is getting a haircut while they're there. They're getting looked at after a nurse. That's 6 more trips I don't have to make. So I'm okay to make this one trip. So
Yeah, that's great. Haircut, bathing. I mean, there's so many
yeah,
options
exactly.
and provided an adult day. That's why I love adult day. It's so awesome. I see a question in the Q&A box from Tia. Tia says, "Hi, in search of an adult day center for her father-in-law, who was an elder Black man with Alzheimer's disease. It was challenging to find one that incorporated cultural components to their daily activities, meal planning, and engagement opportunities. Can you share some examples of how organizations do this or ideas for adjustments that can create an inclusive atmosphere?"
I'll, I'll talk to it a little bit. And I appreciate the question. And, again, it depends on the area, whether it be the Northeast, Northwest, South, there is so much variability in demographics and the way companies operate, the way nonprofit organizations operate. Um, Adult Day, again, I mean, I have to throw kind of the business proposition out there, whether it be the for-profit, not-for-profit side. These programs have to be sustainable. It is a low cost delivery of service. It is a low reimbursement service. So, people, when they start programs, generally have to be inclusive of the area and be able to make a sustainable program. So often it takes some time to really hone in on what that specific demographic is. And there's also some regulatory challenges. There are federal requirements in the HCBS final rule setting for Medicaid where you have to be open and available to providers or individuals of all walks, all races, however you can tailor to specific cultural demographics too. So there's challenges, but again, if there were 10,000 programs or 25,000 adult day programs across the United States, and there would be a more availability of a culturally adapted program, a language specific program. There is a significant growth of ethnic specific programs. I mean, I'm still, again, I'm from Middle Tennessee, but I have a few friends that run very large and always, fully at capacity Haitian Creole programs, and there are dozens of them. And I had no idea in small rural towns across the eastern coast what a large Haitian Creole population was. In Middle Tennessee, it is the second largest Kurdish population in the United States. It's truly amazing where these pockets of specific, cultural identities are, and the ability for someone to function in that environment too. So there is a challenge from a business proposition, but at the same time, it's really more of a startup challenge, and then it's of the ability to adapt to the environment that's operating.
Bill, if approached by a family and they wanted that kind of inclusion, is that a conversation that's open to being had, or some considerations being made? Yeah.
Yeah, I mean, most programs they're able to provide a significant flexibility. So
Mhm.
if there is an individual and it's really truly person-centered care. So if there is a barrier, if there's feedback and say, hey, we really would like this, or we would really like this, most programs are going to say, okay, let's figure out a way to do it. And
Mhm.
that's generally very responsive. Often there is a hesitation from caregivers and participants to say, I don't really like this. Can we do something different? There's a fear of saying what they really want. Sometimes negative feedback is withheld because that they fear a risk of repercussion and
Mhm.
reciprocity. You can ask anyone on this call and anyone in the adult day space is please give me everything. Give the good, the bad, the ugly, because I always want to make my program better for our participants.
Yeah.
Yeah.
I
feel like
would
it
I would
might
say, I
be,
mean, for years. Oh, sorry.
I feel like it might be something similar as to when you go to the doctor and the doctor says you need to be on this medication and this one, and we're going to do this instead of asking the question or advocating. So it's something that we're learning to do with doctors' offices. So it could be done in the adult day setting too.
Absolutely, absolutely. So I'm recognizing the time, so I'm going to ask one last final question, and then I'll go into an overview of what we talked about today. So looking to the future, what do you see as the biggest opportunities for Adult Day in the next 5 to 10 years? That's a big question.
I would say like innovative programs like Guide and gathering the evidence from the program, and seeing how it benefited the participants, the families, and replicating programs like this.
Yeah.
Yeah, I
From a
completely
systems.
agree. Oh, sorry,
Oh,
Tia. Go
Rochelle,
ahead.
you and I are just on the same page. Go. I'm so sorry.
Yeah, I think too that ADS are the places, the space for innovation. So um, you have this great population with your older adults and your caregivers. Again, apply for these grants. Right? Worst case scenario, it doesn't go off quite as you hoped or expected, but you're still having that great impact, and then you modify going forward. So jump on these opportunities. Don't be afraid to put your hat into the mix. I also think too, we think about data. I love data. I love storytelling. This is the place for it. So get the data, share it. This report that's coming out, I can't wait to read it because we need this to advocate and to show our policymakers that this is an important conversation, and that we need the resources, we need the policy changes, whether big P, small p, that this is a topic of conversation, and our adults are living much longer. So that population is, I give the statistic that in the next 9 years, older adults are going to outnumber our people 18 and under. So we need it now. Let's go. Let's build this infrastructure to keep people at home as long as possible.
Yeah. And I was just going to add exactly to that from a systems wide point, we need to create more adult day centers and truly offer this as an option to the community, right? It can no longer be, oh, I didn't know that this was out there for me. And I think the other piece of this, and where the opportunities lie in the next 5 to 10 years, Lauren, is that, start using these services earlier as your person is diagnosed with dementia and building this routine. I've seen people be in adult day centers. My longest was 10 years. Bill had somebody like 25. Was that the number? I mean, this is a long-term solution that allows people to live in their homes for a long period of time. But you also can't wait until that person is, maybe not quite appropriate for adult day anymore. So I would love to see people using these services earlier and getting into building that community at a maybe not the moment you get a diagnosis of Alzheimer's, because we all know that's probably not appropriate, but start building that routine. But I think from a big picture, NADSA specifically, we are going to change the landscape by creating it first information, education, and resources to people because as you said, there's not going to be a shortage. There's no shortage of older adults. They need us and they need good quality options, and Adult Day is that answer.
I think you lend straight to stigma reduction, whether it's for the person who uses services, caregiver. You know, we've got there that isn't a break from caregiving, but really that way to sustain it. So use it, and it's there. But the stigma, the awareness, that's probably our biggest hurdle in the next 5 years.
Mm-hmm.
I want to add that if we look at adult daycare like Cheers, a place where everyone knows your name, a place where you walk in and everyone knows you, your beer is waiting for you, your people are there. It's that place. Then yes, we start earlier. We find our social clubs, we find our tribe, and we get together. I see much more focus in the future on culturally specific centers. I see more people getting together and helping themselves as a community and saying, yes, we're all from Tunisia. Let's all get together and have the food and our culture and our community and support each other. And this is how we're going to age, because this is the way they've aged for eons. So really, really understanding that we all need our Cheers. We all need that place that we go to, that we don't have to walk in and tell someone we're sick. You look at me and I'm not the same. Much like our schools are for our children. And if you want to see change coming up, and yes, definitely language and faith-based, there are barriers that we don't see, and the seniors do see and feel it. So you need to be seen and felt and understood in order to be better served. And the best way to move adult day service forward is invite your politicians in. Let them see from themselves who is in your center. It's a voting year, it's an election year. So bring them in. Let these politicians see that our seniors aren't decrepit and in the corner, fading away. They're just like you and me, and they want that friend, and they want that moment to touch each other. So please, every adult daycare out there, bring in your politicians. Let them see for themselves with their eyes and with their hearts who these seniors are, because they're not dying. They're going to live forever. So we need to be there for them.
Doris, is a perfect opportunity to throw my 2 cents in too, because the stories and the anecdotes are incredibly powerful, and combining that with comprehensive data to show the value of adult day services from the healthcare system, from the personal outcomes, from the functional outcomes, comprehensively putting the data together with the story makes it an incredibly powerful message. And one of the reasons I'm so excited about the guide program from CMS is finally there is a system that is realizing that adult day services is caring for a dyad. Researchers know that it's all about dyadic care. Adult day service providers have generally, we serve the participant and the caregiver benefits to it, but truly we serve the caregiver just as much as we serve the participant. And there's finally some illusion of value to that true dyadic care. You put those together, and I always have to throw in, the tailwinds that are coming behind the, adult day services. The pandemic really exacerbated or increased the push for deinstitutionalization. Yes, there are caregiver challenges, especially in the home care space. By and large, adult day services does not experience the same staffing challenges because they're group-based care environments. Programs are staffed for more than that are available to come in. So even if a few people aren't, a few staff members aren't there, they're still open and providing a high level of services. So caregiver crisis is much less effective, much less of an effect in the adult day service environment. You push all that together, And at the end of the day, it's all about community partnerships to spread the word about the solution is available. You increase the provider network, the network advocacy is there, and it's the tailwinds are they're only growing.
This is so great. You all have provided such great nuggets from operating in the margins, operating in the mainstream. Then we talked about cheers. And so, thank you so much, panelists, for being here. I'm just going to give a quick overview with some slides to kind of like hone in what we talked about and thinking about partnerships between public health agencies and adult day programs. Next slide, please. So, as we said, adult day is essential. I think we cannot walk away from this conversation today without acknowledging the essential role that adult day plays. They provide safe, stimulating opportunities, environments for the person with dementia, and then also they provide respite and support for people who are providing care. Public health agencies are also critical because they play a role in prevention, health promotion, and community level intervention. So thinking more about these type of partnerships that adult day programs and public health, if they came together, and the needs that they can address and how they can expand access to care, and also think about how they can reduce gaps and disparities in care as well. Next slide. So, high level, some of the things we talked about today in terms of health promotion and preventative care, we've heard from Doris and others about how bringing on site health screenings and vaccinations can be such a critical role, thinking about flu shots, COVID, blood pressure, and even physicals, bringing that to the people where they are without making an additional hurdle to have seek out those services somewhere else. Having health education sessions, so thinking about fall prevention, as our good friend raised in the Q&A, thinking about brain health, nutrition, medication management, and then also wellness programs. A lot of our conversation today talked about how there are some wellness programs that are just provided to the persons living with dementia or the persons who are attending the adult day programs, thinking about chair yoga, stress reduction, and exercise classes. And these can be led or also co-funded by health departments. So thinking about these types of partnerships, this might be a great avenue for public health agencies to step in and to partner with your local adult day programs. Next slide, please. And thinking about caregiver support, um, just by its nature, adult day is such a great hub and a resource hub. So public health programs can support and provide funding for vouchers for families to access adult day programs. They can provide training and education programs and thinking about managing dementia, stress, and navigating community resources. And then also just maybe being there as a way to provide and facilitate support groups. I'm going a little fast because we are finishing at 1:15, but these slides will be available when we send them out and they will be in the resource hub as well. Next slide, please. Um, Surveillance and data sharing. I think adult day is a great place because you can tell what's going on in the community. We are having an outbreak, COVID, flu, something's going on. We need service. So they can just service these sites to monitor what are the community health trends in terms of cognitive decline, stress, and other health conditions as well. Program evaluations, collaborations with public health programming can generate data on outcomes of ADS participation, feeding into a broader picture of what is aging services going to look like, and maybe thinking about health projections in the future. And then lastly, as it relates to surveillance and data sharing, thinking about emergency preparedness data. ADS sites can help identify vulnerable older adults who need targeting for outreach in terms of disasters or pandemics. Next slide. And this is almost the last slide. Policy and systems integration, embedding ADS into aging and dementia friendly communities, collaborating for reimbursement models. We talked about some Medicaid waivers. We talked about guide and caregiver support. And then advocacy. We need advocacy. So I love the thought of bringing in local politicians to think about and look at the local aging communities to really understand their needs because they take such a bulk of our community and spaces, especially as we're coming up in more and more time because we know there are going to be way more older adults. Last slide. Lastly, for me, I'm a researcher and scientist. I'm always going to think about research and innovation. So, piloting programs, developing new and testing programs in adult day, implementing research, evaluating culturally tailored models. Maybe it does work. We adapt some models of care to people's cultural and linguistic needs. And then knowledge exchange. In terms of research and innovation, that's all we're really about is exchanging knowledge so we can develop best practice. Last slide. So to conclude, public health programs, adult day programs are public health partners. ADS programs go beyond social models. They advance health promotion, provide respite, and reduce health systems burden. Partnerships are essential. We really need to collaborate more with public health agencies, community organizations, and federal initiatives to support Adult Day. And then the future's opportunity. We discussed here a number of barriers, but we also discussed a number of ways that we can identify solutions and work towards advocating and promoting Adult Day. I think I did that kind of fast, but still kind of good. We got it together. So thank you again, everyone, for being here today. We so appreciate the panelists. Thank you. And then everyone who spent an hour and 15 minutes with us. Please, if you can, complete the survey and evaluation that you'll get a link to. And these resources will be available on our website. Have a happy Tuesday.
Thanks, everybody.